A 45-year-old man sustained posterior fracture dislocation of his left shoulder due to first-time epileptic fit. He was initially treated elsewhere in the form of attempted manipulation and K-wiring, but this failed due to the unstable nature of the fracture. He came to me a few days later, and decision to proceed with primary hemiarthroplasty had to be taken due to doubtful viability of the humerus head during surgery. And both greater and lesser tuberosities were anatomically reduced and fixed, and at 3 months there was good bony consolidation at both the tuberosities, and as can be seen in this x-ray, there is good callus formation. Clinically, the patient was pain free and regained full range of movement. He could also demonstrate equal power in his supraspinatus when compared to the opposite side, and as you can see, his rotations are also normal and has good power in infraspinatus as well. So the message here is good apposition of tuberosities is essential to get a good outcome in hemiarthroplasty.